Welcome back to Weekend Prime, and now let's talk health. Researchers estimate that about 1 in 9 adults globally is living with diabetes, and over 90% of those cases are type 2 diabetes. In Kenya, the disease is rapidly evolving into a public health crisis and remains significantly high in urban centers like Nairobi. And as more people slowly develop the silent disease, experts warn that diabetes knowledge and testing awareness remains critically low, a gap that is slowly fueling diabetes-related complications that account for over 60% of all hospital admissions in Kenya. Here's Gloria Milimu with more on this week's episode of Health Digest.
Kenya is facing a rapidly worsening diabetes crisis, currently being fueled by urbanization, physical inactivity, and dietary changes that are driving surging rates of type 2 diabetes, according to experts. The statistics are grim, yet majority remain undiagnosed and oblivious of the chronic condition that could be wreaking havoc in their bodies. The condition where one's body either cannot produce enough insulin or cannot use it properly, causing sugar to build up in the bloodstream, could be affecting more Kenyans than previously suspected, especially those in urban centers like Nairobi. And now, experts warn that a critical knowledge gap and community awareness about testing, early symptoms and myths is fueling type 2 diabetes in Kenya, with over 800,000 adults said to be affected. We took a drive to one of Nairobi's densely populated residential areas to establish diabetes knowledge among the community members, and the responses pointed to a worrying gap that is slowly fueling a surge that can no longer be ignored.
Tujaisikia, mimi nasikia na wewe hadi sisi labda tupime ukimwi peke yake. Tunajua ni ukimwi tu ugonjwa, si tujaijua diabetes.
Sijaisikia wala kusikia maoni yoyote kuhusu mambo na diabetes. Ndio naisikia kutoka kwenu.
Sinasikianga tu nasikianga, lakini naonanga ni hao watu wamekoma sio vijana sisi wadogo.
This knowledge gap, according to endocrinologists, leads to late diagnosis and costly complications, as many patients only learn they are diabetic after developing the symptoms.
Ningekuwa ninajua symptoms zake, ningeenda nipima at least ni maybe kama kuna venye naweza anza kusuia ama kutibu nianze.
Naona nimefika hii umri na sijaisikia kuhusu kitu kama hiyo. Aje serikali ichukue hatua ipeleke katika sahanati, katika vituo za serikali, waanze kuhamasisha watu kuhusu diabetes.
The tragedy about type 2 diabetes is that it develops gradually, and by the time of diagnosis, experts warn that adverse changes to the kidneys, blood vessels, and even the heart may have already begun. However, one woman has made it a mission to educate the masses about this chronic condition. Reverend Irene Maina, who is also a nurse by profession, has managed type 2 diabetes for 5 years and says she uses her social media platforms and position as a woman of the cloth to steer diabetes prevention and management message. For her, she had all the symptoms that pointed to a compromised blood sugar level. However, not even the frequent thirst and urination ticked the box for her, until a persistent infection later led to a definitive diagnosis of diabetes type 2.
At one point, I thought that I am now past the age of getting diabetes. I had all the cardinal signs that are there for diabetes. In one night, I would go to the washroom twice. Now that was not ordinary for me. As I would do the dishes kwa sink, so not too like it is a kawaida house chore. But as I do the dishes, I realize I'm thirsty. Nina sip maji na ninaendelea. But around that time, I had put in a lot of weight.
For people diagnosed with diabetes like Irene, eating healthy, adhering to medical treatment, and ensuring a regular physical activity plan are factors that cannot be overlooked.
It calls for a transformation. And it is not like it is even giving you time. It is like you have to start now. And that was the hardest, because at the beginning it does not make sense how much of nobody even tells you of how much exercise you need to do.
She says that bridging this educational gap is essential to prevent complications. She argues that understanding the primary diabetes tests and interpretation metrics can help one keep the disease at bay or manage it effectively.
It is a test that you can take even from a chemist. Doesn't take even, actually it takes 6 seconds. In the morning when one wakes up, a normal fasting, because that is now called a fasting blood sugar, should be between 3.9 to 5.5. And now a random blood sugar is a blood sugar that you just take randomly in the course of the day, having taken your meals, just randomly. Should not go beyond 7.9.
While what we eat is the key factor in blood sugar levels, it's not just the foods that impact blood sugar. Stress, hormonal changes, and skipping meals can also lead to increases.
If you have family history, it does not mean that you are condemned to eventually having this condition. That is only a predisposition, yeah? But you can remain healthy. You can put diabetes at bay just by living right, eat well. Those people that are reversing type 2 diabetes, like I have done, that you have not reversed type 2 diabetes to start developing it all over again. So you are not signing for a 3 months, 4 months, 1 year challenge. It is a lifestyle. Yeah, they say, if you achieved it by prayer, sustain it by prayer. If you achieved it by lifestyle, sustain it by lifestyles.
Globally, about 589 million adults have diabetes, with 252 million undiagnosed. Most of these cases, according to experts, are recorded in low and middle-income countries where access to early diagnosis remains limited. In Kenya, it is estimated that about 3.3% of adults have diabetes. And now, one message is clear. Diabetes can be prevented and managed before complications set in. And this can only be done if everyone is empowered and has knowledge about the chronic condition. Gloria Milimu, KTN.
Gloria Milimu with the health.